The 5 W's of breast cancer. In this video podcast, we'll discuss important clinical principles regarding breast cancer. The presentation objectives are organized into the 5 W's of breast cancer that you should remember. Who develops breast cancer? When does breast cancer develop? Why does breast cancer appear in certain individuals more than others? Where does breast cancer occur? What do breast cancer patients present with? And finally, we will discuss how we manage breast cancer patients. First, let's talk about who develops breast cancer. Breast cancer is the most common cancer among females in North America, with 1 in 9 women expected to develop breast cancer over their lifetime. While the majority of breast cancer patients are female, breast cancer can also occur in males. When does breast cancer appear? The highest rate of breast cancer diagnosis is between the ages of 50 and 70. Why are some patients at greater risk? There are many risk factors identified for breast cancer. One main risk factor relates to the level of exposure to estrogen over one's lifetime. These factors include early menarche, late menopause, later age of parity or pregnancy, nulliparity or no pregnancy, and hormone replacement therapy. They are all associated with increased estrogen exposure and hence an increased risk of breast cancer. Some people may also have a hereditary syndrome that puts them at much greater than normal risk for breast cancer, such as a mutation in one of the BRCA genes. Where does breast cancer develop? The breast consists of mammary glands surrounded by connective tissue and fat. Exteriorly, the nipple is surrounded by a dark pigmented region known as the areola. The mammary glands consist of 2 portions, secretory lobules and ducts. The majority of invasive breast cancers are adenocarcinomas, derived from epithelial tissue in these lobules or ducts. High-grade dysplasia in the lobules is known as lobular carcinoma in situ. And similarly, in the ducts, it is called ductal carcinoma in situ. Similarly, invasive carcinomas that develop in the lobules are termed lobular carcinomas. Also, invasive carcinomas that develop within the ducts are termed ductal carcinomas. Mammograms aim to detect cancers at early stages, either before or at the in situ stage, by measuring tissue density through compression and X-ray radiography. Detection at this pre-malignant stage is important, as carcinomas in situ are not invasive and can be curatively treated. When discussing the spread of breast cancer, it is important to understand both the vascular and lymphatic drainage of the breast. Arteries originate from the axillary artery laterally and the internal thoracic artery medially. They travel in a spoke-like pattern towards the nipple. Veins travel parallel with the arteries and drain into the internal thoracic and intercostal veins. Lymph vessels travel in a similar pattern as the vasculature. The majority of lymph vessels drain into the axillary lymph nodes, while the remainder drain into the internal mammary chain. Thus, the axilla is an important region to palpate and examine during physical exam. Cancerous nodes would feel hard, matted down, and tender. This is uncharacteristic of normal lymph nodes. What do breast cancer patients present with? Breast cancer can be asymptomatic at diagnosis and is therefore detected mammographically in many patients. However, some breast cancers will present symptomatically, with a lump or thickening in the breast. In more advanced cases, patients present with nodal disease or metastasis. Finally, how are patients diagnosed and managed? If a patient presents with a mass or mammographically detected lesion, aside from a history and physical, you should try to obtain a tissue diagnosis. Tissue diagnoses are often image-guided and can use an ultrasound or a mammogram in the case of a stereotactic biopsy. We often assess for nodal spread with a sentinel lymph node biopsy, where samples are taken from the first few lymph nodes into which the tumor drains during a partial mastectomy or other operation. Further imaging, such as bone scans, chest x-rays, or CT scans, may be done if metastases are suspected in other organs. This concludes our short introduction to the 5 W's of breast cancer. For further information, you can refer to the breast cancer module on www.learnoncology.ca. Thank you.